The economy may be doing well by many measures, but for years, there have been real concerns over wage growth and the overall standard of living. So perhaps it's not surprising that at least one recent survey showed growing public support for a new government program that would guarantee some income to citizens. There are small pilot projects of how it could work. In this Reprise report, our own economics correspondent Paul Solomon travels to Canada to see one of the larger programs for our ongoing series, Chasing the Dream, on poverty and opportunity.
Cheerios sans gluten.
Without gluten.
I may not speak French, but I've been in a bilingual country my entire life, so I know what the French actually...
What sans gluten means.
Yeah.
A Tuesday trudge to the local grocery store in Hamilton, Ontario.
Love the organic vegetables.
This is the first time 29-year-old Alana Balzer has been able to afford the healthy food here at the Mustard Seed Co-op. Because she says when you're poor,
It's buy the stuff that you can afford, which is generally quick, easy, and all processed and high in sugar and trans fats and all the other unhealthy stuff.
that's all that Balzer could afford on her $575 a month welfare disability check. But Ontario will now give her $1,130 a month, U.S., no questions asked, as part of a 3-year basic income pilot launched late last year.
Around the world, people believe that basic income could provide simpler and more effective income support.
The idea is also being piloted in Finland and California. Now it's Ontario, too.
How are people's lives changed, and how are they able to do better in their lives, prevent illness, stay in school, get jobs, and keep jobs?
Ontario Premier Kathleen Wynne.
We should be looking at different ways of providing support, ways that actually don't punish people, but actually support people in getting on with their lives and produce better outcomes.
4,000 randomly selected Ontarians in 3 communities will get about $13,000 a year U.S. for a single person, $19,000 for a couple. In exchange, recipients give up some social supports, and the government gets back 50 cents of every dollar they earn.
It is definitely the biggest basic income study that there's ever been in North America. You don't have to show that you're sick. You don't have to show that you can't work. You get it as a right.
Research Director Kwame McKenzie and his team will analyze the results.
We're going to see whether it increases your chance of coming out of poverty. We're trying to see whether it makes your housing stable. We're trying to see whether it improves your mental health, whether it basically decreases your use of other services such as hospital beds.
Turns out Manitoba launched a basic income experiment in 1974 that the provincial government there later pulled the plug on.
It was an incomplete study.
But long after, researchers studying the data found
we've got less health service use, we've got mental health improving, we've got people going back to college and getting better skills to move forward. You know, this is a great thing, right?
But was it a fluke? And could the same policy produce like results 40 plus years later? Well, for Jody Dean and family, the answer seems to be yes.
Okay, hold yours. Have a nice day. See you tomorrow.
10-year-old daughter Madison has suffered from both brittle bone disease and epilepsy since toddlerhood.
How was your day?
It was okay.
Yes, Canada has universal health care, but not for the ER commute.
As far as parking goes, we're not covered for that. That's $25 an emergency visit.
How many times has she broken bones?
Oh, she's probably had at least 70 breaks.
How many times a month do you have to pay for parking?
2 to 3 times a week.
Basic income now covers, in effect, half the parking bill. A huge relief for someone who never dreamed she'd be poor, used to volunteer at the food bank, then found she couldn't live without it.
How do you go back to where you just gave that time and tell them now you're in need?
Jody Dean, like Alana Balzer, lives in Hamilton, a once thriving steel city of 750,000 within an hour of Toronto.
We used to have 40,000 people working directly in steel, and today it's probably closer to 7,000.
Tom Cooper, who directs an anti-poverty project, claims he's already seen benefits from the program.
Many of the individuals I've talked to who are on the basic income pilot are going back to school wanting to improve their opportunities to get a better job.
Moreover, he says,
there's not the oversight we see in traditional social assistance systems that requires people to report monthly on their income or their housing status or their relationship status.
While most poor Ontarians didn't make it into the pilot, Balzer did, and no longer has to deal with the provincial welfare system.
You do not have the bureaucracy involved with welfare or disability. So if you get a job, you simply call, let them know, give them the information, submit your pay stubs, bada boom, bada bang, done.
And your mom made it onto the program. Has it made a difference in her life?
Oh God, yeah. She's more ecstatic about not having to deal with Ontario Works, the welfare workers.
The pilot has even induced Balzer to lose 5 pounds since November. More exercise, more confidence.
It's the first time in years I've been able to wear high heels without groaning in absolute pain and sheer agony.
As for the depression she's long struggled to fend off,
it's nice to, not have a full-blown episode because I'm worried about whether or not I'm going to be able to eat tonight or be able to pay my rent or do something as simple as laundry.
Other pluses? Well, from the government's point of view, it no longer has to subsidize Balzer's housing. So the pilot's costing Ontario less than $700 a month more.
It's important to measure that and measure sort of use of government services.
But if Balzer attends college in the fall, as now planned, and then gets a job, government would be off the hook entirely.
But it's also important to measure whether people are actually generating wealth. Because everybody's thinking often about the cost, but people don't always think about the possible economic benefits.
But look, say skeptics, basic income will cost a pretty, albeit Canadian, penny going out, while benefits may never actually flow in.
I don't think the savings are actually going to be there. So I think that's misleading.
That's local lawyer David Wakely, who says if the program is extended universally, it would cost Ontario 2/3 of its annual revenue. And he doubts recipients will go to school or get a job.
Where someone can stay home and get a basic income guarantee. This just serves as a security blanket for them because they've always got this income to rely on.
And as I asked former U.S. Union leader Andy Stern, isn't that the time-honored objection to a basic income?
If you pay people to do nothing, isn't that an incentive for them to continue to do nothing?
There are always people going to stay at home and take advantage of government programs. There are a lot of wealthy people and children who are paid to do nothing, and it doesn't seem to affect them being vital and involved in society.
John Clark of the Ontario Coalition Against Poverty doesn't worry about poor people taking advantage of the basic income, but he does worry that the program is a move to take advantage of them by laying the groundwork for the elimination of government-provided social workers, health care, the eventual privatization of social services.
So you're shopping for healthcare, you're shopping for housing, you're shopping for public transportation, childcare, all these things. And this is the prevailing agenda at the moment, and a basic income system takes us in that direction.
Moreover, says Clark, a basic income creates downward wage pressure on the working poor.
If you create a situation where low-wage workers are receiving a significant portion of their wages out of the tax revenues, then the pressure on employers to increase wages is reduced, the pressure on governments to increase minimum wages is reduced.
So how to know then if the costs outweigh the benefits?
We can have all of these theoretical discussions, or we can say, let's do a test and see what actually happens. What are the costs? Is it a more efficient way of giving people who need it support? What are the benefits? Does it grow the economy or not? And then we can have a rational discussion based on evidence rather than just based on theory.
And rather than based on promises of breaking the cycle of poverty, which might or might not in the end be mainly smoke and mirrors. For the PBS NewsHour, this is economics correspondent Paul Salmon reporting, mainly from Ontario.
Tomorrow on the NewsHour, more in our Chasing the Dream series, with a report on helping people remain stable after they start work and begin to earn incomes again.